Potassium is an important mineral that helps the muscles, nerves, and heart function properly. In healthy people, the kidneys remove excess potassium from the body through urine. However, when a person develops kidney failure and requires dialysis, the kidneys can no longer remove potassium effectively. As a result, potassium begins to accumulate in the blood. This condition is known as hyperkalemia, and it can become very dangerous if not controlled. High potassium levels may cause muscle weakness, fatigue, numbness, tingling sensations, irregular heartbeat, chest discomfort, and in severe cases, life-threatening cardiac arrest. One of the biggest dangers of high potassium is that many patients may not experience any symptoms until the level becomes critically high. For this reason, regular blood tests and medical monitoring are essential for dialysis patients. The most effective way to control potassium is through a combination of regular dialysis, treatments, and a kidney-friendly diet. Dialysis helps remove excess potassium from the bloodstream, but between dialysis sessions, potassium can build up again, especially if a patient consumes foods that are high in potassium. Foods such as bananas, oranges, mangoes, dates, avocados, potatoes, tomatoes, spinach, coconut water, dry fruits, and chocolate contain large amounts of potassium and should be limited according to the advice of a healthcare professional. Patients should also be cautious about fruit, juices, and processed foods that may contain hidden potassium additives. Fortunately, there are many lower potassium food options that dialysis patients can enjoy. Fruits such as apples, grapes, pears, and pineapple are generally lower in potassium compared to bananas and oranges. Portion control remains important because even lower potassium foods can contribute to high potassium levels if consumed in excessive amounts. Patients should follow the dietary recommendations provided by their doctor or renal dietitian to ensure proper nutrition, while keeping potassium under control. Another important step is never missing dialysis sessions. Skipping or shortening dialysis treatments can allow potassium to rise rapidly in the blood. Patients should take all prescribed medications as directed, attend scheduled dialysis treatments, and undergo regular laboratory testing to monitor potassium levels. Reading food labels, avoiding unnecessary supplements, and discussing dietary concerns with healthcare providers can also help prevent complications. Managing potassium is a crucial part of staying healthy on dialysis. Through regular dialysis treatments, careful food choices, routine blood testing, and close communication with healthcare professionals, patients can significantly reduce the risk of dangerous potassium levels and maintain a better quality of life. High potassium is a serious condition, but with proper knowledge and consistent care, it can be controlled effectively and safely.